So,
Thank you.
Annalisa Trama, the Director of Evaluative Epidemiology Unit at the Istituto Nazionale Tumori, Milano. And Annalisa will tell us about how to unlock the potential of real-world data of rare solid cancer of adults, the EURACAN data ecosystem to reduce disparities in cancer. Annalisa, for
Thank you, Ivona. Thank you for inviting me. And I have to thank all the speakers that talked before me, because they really helped me in introduce the importance of the topic, and especially the importance that data can have in really not only report about inequity, but also to understand inequity. And if we think that currently we are talking about more than 2 zettabytes of health data globally available, you can understand how important it can be now to understand how to access the right data. The point is that I think you heard this story many times. They are in silos. Not only, I would say, silos that are related to different technologies and problems of interoperability. We have a huge problem because these data are really highly regulated differently in the different countries. So we really have an issue that if this data will not be properly shared across Europe, also the different availability of data across country may indeed increase disequality, because we might end to have to balance the risk not to have data geographically across all the different countries. So what is our proposal? Well, first of all, for us, it's going to be important to understand that one single hospital, one single country will never have enough quality and quantity of data to really produce data-driven results. We are dealing with rare cancers, and that's why we decided to leverage network. At European level, there are the European reference network. We are leveraging network EURACAN, which is the one on rare adult solid cancers, the most, I would say, common type of cancers. But the networking is something that it's increasing at European level. This afternoon, there will be a full session about new networks that are going to be established. And of course, I think OACI is basically represented across all this network. So there is an issue to be discussed also within OACI, how OACI is intended to position itself if, as we hope, we really want to develop a data network, because this is the ambition of what EURACAN is proposing, is really to move from a single centers into a data network. How to do this? This is really a challenge, because currently we are really facing a terrible moment, because we are in between a period where everybody is looking really forward towards, huge project, big data, but we know that we don't have the technology yet to really make it available, in the everyday life. So today, how we work with data, we still work in between. Some paperwork, some electronic data available, but still there is a lot of human resources around, this data. So the point is, how do we move from this in-between situation to really what everybody is looking forward, where everything will be, automatically extracted from the files and ready available, for clinical setting and for research. What we are trying to do is what I'm going to explain, and I really, this is a topic for discussion within OACI as a network, as a possible future data network. First of all, we want to invest and leverage the data that are already available. So if someone has already input effort, any type of effort in developing a database, we really want to leverage it. We know that when we want to work with different databases available across different centers, these are extremely different, because we're developed in different ways for different purposes. We are lucky because internationally there is a community that is working to provide worldwide and international recommendation for defined standards. And these are standards that are actually well understood and also promoted at European level. I'm talking about the OMOP, the Observational Medical Outcome Partnership Common Data Model, which has exactly the principle of translating, different database into one that will be basically the same across the different centers contributing. It's an open source, because when we discuss about data, I stressed already the point of investing resources. And of course, the IT, the technological solution around the use of data is something that is highly expensive, is highly costly. And that's why it's important to consider who is working at an international level for open source solution, because there are community around that will keep updating the tools available without necessarily the need to invest funding for private company developing IT tool. Yes, we tested. We are currently developing the EURACAN sarcoma registry, mapping into OMOP, already available dataset. We presented to the Odyssey, which is the community working with this common data model, our first result. We are currently mapping 7 centers database into the OMOP one, with the idea then to perform analysis. We have positive results that are really comparable to what has been already published on a specific use case. So we are currently working to show that working in a different way can produce the same results of of the results produced as we were used to. The point is that EURACAN includes many different centers, many also OSCI centers. So the next step would be really to understand how we can scale up from these 7 data providers into a wider number of centers. And currently, it's ongoing a survey that is mapping the availability of sarcoma database across the different EURACAN centers. But of course, we know that not all expert centers for sarcomas or other rare cancers are in EURACAN, and that's the reason why I always say is that the EURACAN registry is open also to non-EURACAN centers, but of course the main point is to have a reliable expertise on the cancers we want to make the research of. So this is one way, in which we can consider to leverage, the resources already invested in developing a data set that are, of course, real-world data set. The other point, I have to go back here, and I agree with the request and the question raised by Ivona earlier on. We are working within the GDPR. Even if at your level, plenty of regulation came out, the Data Act, the Data Governance Act, 2 months ago, the AI Act, still all these regulations have as a standing point the GDPR. So we are still facing with increased privacy requests and increase privacy, I would say, really sometimes very burden and difficult to explain requests. But anyway, we need to cope with it. And that's why we decided to be as much as possible privacy preserving, privacy compliant. So we are really investing in privacy enhancing technology, which can be different ways, pseudonymization, anonymization. What we have decided to invest in is the federated learning, which is basically a machine learning approach that trains algorithm across decentralized data set, and the idea of starting to develop decentralized, federated infrastructure has been already mentioned. Here, the idea is the same. We basically keep the data at the site. We don't move the data. We develop an infrastructure that uses the federated learning, which is, again, it's an artificial intelligence way for training algorithm to perform analysis without having the data moving from the original source. What is basically traveling is either the results of the data that is analyzed locally, so aggregated data, or sometimes it's just the weights. When you have to do some modeling, what is coming out are the weights that you need to process for developing the results. So we are really trying to find innovative solution for developing privacy-respected, federated approach for a data network. Why? I left the why as, the almost final consideration, because I think I'm talking to researchers, so to people that are convinced why, to use this data would be important. Well, for rare cancers, this is essential, because we discussed a lot about inequities, of course, across countries, but I'm sorry to say there are inequities also within different types of cancers, and the rare cancers are really those less known. For which there is an increased need also to understand the cancers. And there is still a huge differences in terms of quality of care. And that's why, within the EURACAN registry, we are really trying, to have this data network to increase understanding of rare cancers. But we know that this has to serve different and future type of research question. That's why we use it also as a pointer. So we collect information about availability of imaging and biosample, because we really want this data network to be the basis for any type of research in future. But this type of data are, of course, really relevant also to start dialoguing with the regulators. And we need data, and we need also to be creative in the way we discuss with the regulators, which are also very interesting in real-world data, because, of course, they develop these Darwin EU initiatives that is really trying to develop real-world evidence. And guess what? They decided to use the Homo data model as a starter. That's why our registry was basically, and the data network we are envisioning, it's already designed and envisioned to also support requests that might come from the European Medicine Agency, which is the same that is proposing registry-based studies, that is really trying to understand how real-world data could be used also, for supporting regulatory discussion. And I can tell you that especially for rare cancers, this is something extremely important. And again, we are envisioning to have a data network, and we have to position this data network. This also has been already mentioned earlier on. The European health data space is coming into the reality in almost around 4 years. So we really have to understand how we can contribute to the European health data space. But again, maybe it's because I'm always dealing with rare cancers that I tend to always look behind Europe. And that's why we decided to invest on the HOMOP and on the Odyssey community, because with the same tools and with the same standard, we can easily leverage also international community, and really for rare or ultra-rare tumors, of course, Europe sometimes is not enough. There's plenty of challenges that needs to be addressed. But I think that, unfortunately, while the technical aspects are easier to address, because technical people with appropriate resources can more easily find, I would say, a solution. What I find extremely different currently to address are really the legal and regulatory issues. And that's why I think that, again, a network can better address it. Because now we are really facing a balance between a very privacy conservative approach that is also undermining, I think, the trust that collaborative network of researchers are used to work with. That's why I think that working network that are used to work together, we can increase the trust, maybe reducing, okay, the burden, and this idea of the privacy has the most important right, because I think there is a right for patients that sometimes is much more relevant. We are working also on higher innovative solutions where we are trying to use AI tools for really automatically extract the data, but this is not for today, okay? These are innovative technological projects that the EU is financing with millions of euros. This is not for today, it's for tomorrow. That's why I think that what I'd like to discuss with OACI is really, how can we move from the situation of today to the situation of tomorrow? How much OACI would be interested in investing, okay, to bridge the gap between today towards tomorrow, which of course means to still invest, in human resources and in a work that nobody, okay, is really maybe interested in doing. It's a work of collecting data, still unfortunately manually. But why it is needed? Well, it's the topic of today, because inequalities exist, and especially for rare cancers, there is still a lot to be understood, also in terms of quality of care across different centers, and that's why one of the main questions that centers contributing to the registry are asking is to compare, okay, the way they are treating the patient with the others towards benchmark that are including data in the registry. And I stop here, really thanking all these small bunch of people that are believers in data and are really trying to test a new way of putting data together for the data network of tomorrow.